Hi, Joanna. My name's Marianne.
Hi.
I'm the nurse today that's going to kind of be getting your information, and then the physician's going to come in and talk to you about your wrist. That's the reason why you're here today?
Yeah.
As I understand it, you were in a motor vehicle accident?
Yeah, I was rear-ended. And I went into the ER, and they said it was a sprain, but it's still really, really bothering me. It's really tender.
Okay. Tender to touch?
Yes.
On a pain scale of 0 to 10, what would you rate your pain there?
5.
5 out of 10. Increased pain with movement?
Yes.
Okay. So, and it's your right wrist?
Yes.
Okay. Your last menstrual period?
It was about 8 weeks ago. I found out at the ER that I was pregnant. So.
Okay, so you did get a positive pregnancy?
Mm-hmm.
Okay. When they did it, did they do a blood test? Or?
Yes.
Okay, so it was confirmed. Any medicines that you're taking?
No.
None. Any surgeries that you've had?
No.
None. And do you feel safe at home?
Yes.
Do you feel safe at work?
Mm-hmm.
Okay, so another part of our screening process is for alcohol use, and we do that on every patient. I'm going to go over the audit questionnaire with you. Is that okay?
Uh-huh.
Are you comfortable with that? So this is the audit screening tool that we use, and there's 10 questions, and I'll go over each of the questions with you. The first question is, how often do you have a drink containing alcohol? The choices are never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week.
I only really drink socially, so I would say 2 to 4 times a month, maybe.
Okay, so a 2. How many drinks containing alcohol do you have on a typical day when you are drinking?
Just 1 to 2.
1 to 2, so not very many.
Yeah.
How often do you have 5 or more drinks in one occasion?
Never.
Never, all right. And then how often during the last year have you found that you were not able to stop drinking once you started?
Never.
Never. How often during the last year have you failed to do what was normally expected of you because of drinking?
Never.
Never? Okay. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session?
Never.
Never. Okay. And then how often during the last year have you ever had a feeling of guilt or remorse after drinking?
Well, normally I don't, but since I found out that I was pregnant, I'm a little concerned about the alcohol that I have consumed in the past couple of months. So I guess there's that concern. I would say typically never, but in this case, a bit.
So, okay. So probably less than monthly?
Yeah.
Okay. How often during the last year have you been unable to remember what happened the night before because of your drinking?
Never.
Never. And then have you or somebody else been injured because of your drinking?
No.
No. And has a relative, friend, doctor, or either any other healthcare provider been concerned about your drinking and suggested that you quit?
No.
Okay. So you said that since you found out you were pregnant, that you might have had some feelings about guilt.
I used to think that it was not okay to drink at all, but I just, through things that I've read and things that are like on the news and things like that, that it was maybe okay now to have a few glasses of wine while you're pregnant. But I don't know for sure, and so now I guess obviously I really want to know.
Okay.
Yeah.
Good. So do you want to talk a little bit more about alcohol?
Yes.
Okay, great. You know what? I actually have a little handout here. So this is the fetal development chart that we talk about with alcohol. And actually, yes, you were right. There was a lot of studies out there about 2 years ago that said that perhaps alcohol was not a bad thing during pregnancy. It really was the media hype around it misrepresented the information. So the truth is, any alcohol during pregnancy is not okay. And we're worried about fetal alcohol spectrum disorder with children. If you can see this like fetal development chart, it kind of tells you what's happening, what's being developed. And you're in week 8, so you're looking at like the mouth and the ears, and those are things that the alcohol could affect at this time.
So will my baby be okay?
So that's a great question. Another thing that they found is that stopping alcohol from when you find out that you're pregnant or in the early pregnancy is really the best. What would be we got the con, right? So
Mm-hmm.
you and I, you want to quit drinking
Yes.
because you're pregnant and you understand the implications of drinking in pregnancy. But what's one of the pros that you've had with drinking?
Well, I drink socially, and I usually do so at a lot of like business dinner meetings, and I'm not ready to tell anyone that I'm pregnant yet, so I'm a little worried about what I should do when those things happen.
Right.
And how to kind of...
So you don't want to tell anybody at work that you're pregnant.
Right.
And usually you drink during those social engagements. And so if you weren't drinking, they might suspect
Yes.
something or ask you questions.
Yes.
And you're not ready to...
No.
So is that okay, good. All right, well then let's talk about some steps or some options that you might have to still feel comfortable in those social situations at work and yet not drink alcohol. Can you think of anything that you could do?
Well, obviously, ordering non-alcoholic drinks, I'll have to kind of figure that out since normally I do. Or maybe talk to the waiter or the waitress
Right.
separately and just let them know that.
Yeah, a lot of the times if you ordered something fizzy and clear, a spritzer or seltzer, and throw a lime on it or a lemon, everybody thinks you're enjoying a lovely cocktail, and really you're drinking seltzer water.
Okay.
So that's one of the ways that, that you could cope without having people ask you, oh, Joanna, why aren't you drinking? I think it's wonderful that you are interested in fetal alcohol spectrum disorder. And did you want some more information on that?
I would love some, yes.
Okay. That pamphlet that we just looked at, I'm going to give that to you.
Okay.
And then what I'm going to do next is just tell the physician that we went over some alcohol education and that you are pregnant and that you're aware. So there's the pamphlet for you.
Okay.
And then he'll be in to check you out on your wrist.
All right.
Good luck with the pregnancy.
Thank you very
And good
much.
luck with your wrist.